Well, good morning again, everybody, and welcome back to Morning Coffee here on the Radio Vision Network. And look, we got to talk about something important now. It's not always the easiest conversation to have, but it's a conversation that's absolutely necessary because it's about your health. And November just happens to be National Bladder Health Month. So, in order to talk about your bladder, we needed to have an expert on the line. So, she is a doctor. Her name is Kathleen Kobashi, and she is on the line with us right now. Good morning, doctor, and welcome to Morning Coffee.
Good morning, Mark. Thanks for having me.
You're quite welcome. Look, millions of Americans struggle with this, different types of bladder conditions and diseases, but this is a really hard thing to talk about for most people. So how do we help people take an active role in their bladder health? This is National Bladder Health Month.
Yeah. Well, as you mentioned, Mark, November is National Bladder Health Month. It's the time of year when the Urology Care Foundation really wants to raise awareness in the public to really empower individuals to get educated and to take an active role in their bladder health.
Is there like certain signs or symptoms that people should be aware of? Maybe like a discomfort or something that could be a clue that they're having some bladder issues?
Well, of course, bladder conditions can range from leaky bladder, like when you gotta go, you gotta rush to the bathroom and get out of my way, it's coming out, to leaking with exercise or coughing or laughing or sneezing, to nighttime frequency where it's really affecting your sleep pattern and your quality of life, all the way to something more serious like bladder cancer. So, of course, depending on what type of bladder condition that you have, the symptoms are going to be different.
Well, is there like symptoms that maybe people ignore that they should be paying a little bit more attention to?
Well, sure. So it's not that easy to ignore something like leaky bladder if you're having accidents in the supermarket. So that's a little bit easier. But
Right.
certainly, I think it's important for people to know that there are accessible treatment options that are available. So for leaky bladder, it's going to be, when you got to go, it starts to come out and you can't control it, versus leaking with exercise or coughing or laughing. But more serious might be something like burning when you urinate, or urinary frequency that's keeping you up at night, or blood in the urine. So I would like to emphasize that, on that spectrum, on that end of the spectrum, if somebody has a drop, even a drop of blood in the urine, even if it goes away, it is very important to talk to your healthcare provider about it, because that could represent something more serious.
Well, and look, you're the expert. Is there a way to make people more comfortable to ask the right questions? Is there any advice that you can give maybe people that are struggling to ask the questions to their doctor?
Well, I would encourage you, all patients or all the public, if you're having any of these symptoms, don't be embarrassed. It's not something that we've never heard of before. And I think it's important to talk to your healthcare provider. I think another really, really great resource that's really geared toward patients is the Urology Care Foundation. The website is urologyhealth.org. There's a lot of great information there, and I think when patients go there, they realize, obviously, if that website wouldn't be there if they were the only ones on earth that were experiencing these things. So don't be embarrassed. Talk to your healthcare provider. And even if it turns out to be nothing, I think it's important for people to come forward and ask the question.
Yeah, it is. It's so important because your health is the most important gift you have, right? And if you're uncomfortable talking to your doctor, you need to figure out a way to kind of bring up some of those tough subjects. But I'm kind of wondering, and I'm talking to Kathleen Kobashi, who is a urologist, and she just knows so much about this. But how are some of these bladder issues being treated today?
Well, of course, it depends on, the condition that you have. So starting with something like urinary leakage, urgency, when you got to go, that can be as simple as just dietary modification and avoiding things that irritate the bladder, like a cup of coffee or a cocktail. Not to say that you can't have those things. You just want to be a little bit more strategic about when you take your caffeine or any of these other bladder irritants. Physical therapy, pelvic floor muscle exercises, things like that can also be very helpful. Then there are things like bladder pacemakers and Botox injections in the bladder, which sound invasive, but they're actually quite simple. A lot of times done in the office and certainly in the outpatient setting. For leaky bladders, for coughing, laughing, sneezing, leakage, we can inject a little bit of bulking agent in there, just like the gals or guys and gals are injecting sort of cosmetic filler. We can fill the urethra, the tube that you urinate through, and pump it up a little bit, or put a little hammock in underneath the tube that you urinate through. For urinary tract infections, obviously we treat the urinary tract infections, but if possible, we try to do things that prevent urinary tract infections from happening in the first place. Nighttime frequency, which affects men and women. All of these things can affect men and women, by the way. But we can do things like changing your fluid intake pattern and not drinking all the way up until the time you go to bed at night. The other thing is some medications that people are on create more urine to dump, to get rid of some of the extra fluid, and just changing the timing of the medications can be helpful. And then lastly, of course, bladder cancer. Should you unfortunately have that condition, that's very much tailored toward the individual, dependent upon the bladder cancer diagnosis.
Well, I think what you're talking about is we are in a situation in 2016 that there are so many different options and treatments available now that people have to have that gotta-go conversation. It's a necessary thing. If you're having any sort of discomfort, you need to talk to your doctor about it. Now, doctor, do you have... I was just wondering, is there anything else that my viewers need to know about their bladder health? Again, this is National Bladder Health Month, and it's important for everybody out there to be mindful of this. And if you have any issues or questions or discomfort, that you talk to your doctor. But what else do people need to know, doctor?
Well, I think what's most important, first of all, let me just repeat the website information, urologyhealth.org. It's a great resource for patients, and of course your healthcare provider can be a great resource for you. I think my message to patients is really that it's not something that you have to live with. It's something that any of these bladder conditions can have a huge impact on quality of life, and they're all treatable. So I think that's important for people to know. Number one, they're not alone. And number two, there are treatment options that are successful and not big major surgeries or anything. They can be really simple little things that can make a huge difference in your quality of life. So please ask your healthcare provider. Yeah,
and look, folks, Radio Vision Network, we live here on the internet, right? So what I want you to do is open up another tab on your browser right now and go to urologyhealth.org and just look at the website and see if this is something that might be able to help you out. Dr. Kobashi, I want to thank you for spending a few minutes with me this morning on Morning Coffee.
Thank you very much, Mark. It's a pleasure.
Oh, you're quite welcome. Guys, this is important stuff. You need to ask your doctor the right questions, and they're the gotta-go questions during this National Bladder Health Month. So look, go to urologyhealth.org and get all that information. I'm going to take another quick break here on Morning Coffee, but don't go anywhere. We're going to be right back here on the Radio Vision Network. Stick around.
Been the way it always should be, the way it always will be, because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
My dream job is to run and manage my own spa one day.
To be the general manager for the Jumeirah Hotel in Abu Dhabi, Dubai.
I feel that Mercier has prepared me very well for my future in the hospitality industry.
The kitchen is incredible.
You are planning the meal, doing all the costing and the recipes. You're in charge of everything going on in the kitchen.
They really do get you prepared, and they want to make sure that you have a job after college.
When it comes to injuries,
they're not all created equal.
That's why at Performance Spine and Sports Medicine,
our team of doctors will coordinate and customize your care
to provide the best treatment options using the area's most advanced medical technology.
All with one goal in mind.
To get you back in the game.
We call life.
Pain-free.
Drug-free.
Surgery-free. That's what we do here at Performance Spine and Sports Medicine.
Get better faster.
Stay better longer.
Saving your business money is as easy as 1, 2, 3. Tanker Consulting Services, a payment solutions expert, will show you how with a free, detailed, written analysis illustrating your cost savings. We usually uncover savings between 10 and 25%, and sometimes more. We can help your business succeed by providing reliable and secure merchant payment solutions such as merchant services programs, point-of-sale systems, and ATM machines. TCS, one of the leaders in regional credit card processing consulting, offers electronic payments to merchants locally and nationwide through our preferred vendor programs. We work to keep business costs down with a comprehensive suite of quality products, services, and customized credit card processing programs